We have a great show planned for you today. Dr. Bryan Satterwhite of Atlantic Foot Specialists will be talking with us about big toe and heel pain. Then Cheryle Jones-Syracuse from the Brunswick County Cooperative Extension Office will speak to us about osteoporosis. Finally, Amy Myers, the hospital's Director of Marketing and Community Relations, will join us to share information on the opening events planned for the new hospital. Our first guest is Dr. Bryan Satterwhite of Atlantic Foot Specialists. Welcome to the show, Dr. Satterwhite.
Oh, thank you very much, June.
Well, it's been a long time since you've been with us, so let's kind of catch up. Tell us a little bit about yourself and your practice before we get started.
Well, I'm originally from North Carolina, but I've been in Brunswick County about 9 years. I have 2 offices in the county, one in Cheryle on Main Street and a second one in Southport.
Tell me a little bit about that.
It's on Rob Gandy Boulevard, which is off of River Road in Southport. We're really excited about the new office. It's been great so far.
I bet you are. And is it more convenient for your patients there?
We're much more visible there than we were in our previous location, so I think it's a lot easier for our patients to find us.
Great parking and everything.
Much better.
Yeah, that's great. I understand it's beautiful.
Thanks.
How long have you been in Brunswick County? 9 years, did you say?
9 years.
Wow, that's great. Well, let's get to our topic of foot or toe and heel pain, I believe we're going to talk about today. Is that correct?
Yes, ma'am.
And at some point, I'm sure everyone has experienced that. But let's start with the basic questions. When is it appropriate to contact your physician for foot pain?
I think that any heel pain or foot pain in general would be considered abnormal. So if you are experiencing pain, it should be checked out, especially if it lasts more than a couple days and persist.
Well, what are some of the common symptoms of foot pain?
Most of the foot pain symptoms, a lot of them anyway, are directly related to shoe gear. If your shoes are poorly fitted, especially in the coastal region, we have a lot of people who like to wear flip-flops.
Right.
And I see women and men that wear flip-flops almost exclusively, even in the wintertime.
Well, it sounds like folks can do a lot then to ensure that they don't have this foot or heel or toe pain. What can we do to avoid the big toe and the heel pain specifically, as I know these are common?
Well, you want to make sure that your shoes are well fitted, that there's plenty of arch support. That will help your heel pain a lot. You need to make sure that the shoes have plenty of toe space. A lot of people tend to like their shoes very narrow, and if they're too narrow, put pressure, it can cause ingrown toenails, rubbing, blisters, corns, calluses. Those are almost always shoe fit issues unless the corns or calluses are occurring between the toes.
Well, what about the heel pain? What's some treatment options for frequent and severe cases? Stretching,
Icing, anti-inflammatory medications. You can have cortisone injections into the heel. There's physical therapy that you can have, and ultimately you can have surgery. Only about 15% of the people with heel pain will need a surgical repair.
Oh, well, talk to me a little bit about the surgical repair options. What would you do during
There are 2 basic ways to fix it. You can have what's called an open procedure, where we actually make an incision on the side of the heel and release the band, the plantar fascia, or you can have an endoscopic procedure. I typically choose the endoscopic procedure to release the band. People tend to get back to work and on their feet a little bit quicker with that procedure.
Let's talk about that a little bit. What would a patient expect before and after that type of surgery?
Initially, the surgery takes about 25 minutes. It is an outpatient surgery. They come in, they have the surgery, they go home. Afterwards, they can expect to be non-weight bearing or not on their foot for about 3 to 4 days, followed by casting or in a cast boot for about 3 weeks.
Oh, would they be like on crutches? Or?
Yes, ma'am.
Oh, I see. Well, I know a lot of people suffer from arthritis in their hands and so forth. Can you get arthritis in your feet?
Absolutely. It's a very common problem
Really?
to get arthritis in the feet. There are 26 bones in the feet, so there's a lot of joints, and each joint can get its own arthritis. Probably the most common arthritis would be in the big toe joint. It can occur from trauma or it can be hereditary. So there's a lot of places you can get arthritis.
I never thought of arthritis in your feet.
It becomes difficult to walk when it flares up.
Yeah. Well, let's talk about ingrown toenails for a bit. I know that's a very painful thing, and I'm wondering what causes ingrown toenails, and especially on your big toe. Maybe you can get it on all your toes. I'm not sure. Let's talk about that a little bit.
Ingrown toenails generally are the result of improper cutting. You should cut your toenails straight across. If you try to cut them back in the corner, you may leave a little piece, and that piece may try to dive in. Occasionally, it's hereditary. If you're young and you start getting ingrown toenails, or you've had repeat ingrown toenails, it can be hereditary.
I thought it was from shoes, but it's from toenail cutting.
From improper cutting of the toenail.
Really? Wow, that's interesting. Now, I understand, Bryan, that diabetes is prevalent in this area. And I'm wondering if folks with diabetes require specialized foot care, and do you provide that?
Yes, we do provide diabetic foot care. It's very important for diabetics to take good care of their feet. Diabetics.
Why is that?
Well, diabetics can have nerve damage in their feet, which makes their feet numb. They can have poor circulation in the feet. And if you mix poor circulation up with not being able to feel your feet, you can have injuries and not be aware that they're there. So we need to take extra care with the diabetic to prevent amputations, infections.
Amputations?
Yes, ma'am.
Really? And is that from the poor circulation?
Well, it's a combination of developing an open sore, that sore becoming infected, and your body not being able to heal that infection or that open sore because of poor circulation. And unfortunately, in some cases, it leads to a possible amputation.
I see. Well, with summer upon us, and we're very active, and you know our feet are very active, do you have any tips or advice for us how to keep our feet healthy?
Good supportive shoes. I think I said that before, but you know, really good supportive shoes.
That seems like a very important part of all foot health.
Yeah, protecting your feet, good arch support. Down here in the South, there's a lot of bugs and insects. You can get ant bites.
Fire ant
bites. So it's important to really protect the feet. If you are doing exercises or jogging, good socks, clean socks, powders if necessary. Well,
this has been great information from you today, Bryan. We so appreciate you being on the show. Tell our viewers how they can reach you and make an appointment.
Well, as I said earlier, we have two offices, one in Charlotte and one in Southport.
Right.
Our Charlotte number is 755-FEET. That's 755-3338.
Oh, that's cute.
And our Southport number is 457-4333.
Great. Well, thanks again for being here, Bryan. It was a pleasure having you.
Thank you.
You're welcome. Our next guest is Cheryle Jones Syracuse from the Brunswick Cooperative Extension Office. Welcome to the show today, Cheryle. It's a pleasure to have you.
Thank you for having me.
You're welcome. I'd really like to get to know you a little bit better. How long have you been in Brunswick County?
We've moved here a little over 4 years ago. We moved here from northeastern Ohio.
Very cold there, huh?
Yes.
Bet you're enjoying the sunshine.
It's wonderful.
Oh, great. I understand that you recently completed a special osteoporosis project at the Extension Office. Let's talk about that a little bit.
Great, sure. The North Carolina Osteoporosis Foundation recently received a grant from the Cape Fear Memorial Foundation. And the goal of the grant was to teach about osteoporosis in the 6 counties here in southeastern North Carolina. And through the North Carolina Cooperative Extension Service here in Brunswick County, we were able to implement this grant both here in Brunswick County and in New Hanover County.
I see. Well, that's real interesting. What results did you find from this study?
Well, we had a series of classes, some newspaper articles, and actually some exhibits and displays at local health events and places where lots of people were gathering. And what we found were that lots of people had osteoporosis, they had bone density tests, but they weren't quite sure what was the cause and what were some of the treatments that they could have. People were just curious as to risk factors and how did they get this, and then what can they do to prevent it. So we just did some educational programs and encouraged folks to talk with their healthcare provider about osteoporosis.
Mm-hmm. Well, I think many of our viewers would be interested in learning more about this condition. Tell our viewers what osteoporosis is.
Well, actually, the word means porous bones.
I see.
And as your bones are developing, actually you have new bones reforming all the time. And over a 7-year period.
No matter what your age is?
Right, right. No matter what your age. And over a 7-year period, you know, it's a fluxing kind of situation. But as we get older, bones tend to get weaker and losing more mass and more density. Now here's an example. This is a regular dense bone of a fairly healthy person, where this is an osteoporosis bone.
Significant difference.
You can see that the honeycombing in the bone has gotten much wider, it's less dense. Real ability for people to break bones when you have a less dense bone like this. You actually hear people all the time falling and breaking a bone, or actually some folks with osteoporosis very severe can do something simple as sneezing.
Wow.
Or running into the corner of a table and they can break a bone because you can see that there's no structure there because the bones have lost their density. So that is what an osteoporosis bone looks like.
Wow, significant difference there. How can viewers manage their bone health so that they can combat the osteoporosis then?
When we took our training, I thought there was a really interesting comment that they made. I'm not sure I'm quoting it exactly right, but the significance was it's a disease of the young, but it doesn't really manifest itself until you're older. And that was one of our challenges with the project, was we wanted to reach younger people, and primarily younger women, but they necessarily didn't think that meant them.
Right.
Because when you hear osteoporosis, you always think of older women. But it's how you can take care of your bones when you're younger, laying down enough calcium, laying down enough formation in your bones so that when you're older and it starts to deplete, you have a lot to build on. So that was one of our challenges. And we did do some interesting work with some Girl Scouts.
Oh.
There is a Girl Scout badge project it's called Calcium Challenge.
That's great.
And working with the Girl Scouts to get them to think about what they're eating now, when they're eating when they're 8 to 25 is really, really very critical. But they're not going to see the results of that until they're well over 50. One of the things the Girl Scouts did that I thought was really just very creative was they passed out little silly bands the shape of bones, and kids are really into the silly bands, and when they sold Girl Scout cookies.
Oh, that was a great idea.
And they told their purchasers to have a glass of milk with their cookies.
Great idea.
To increase their calcium intake, and just think about that too.
Yeah. Well, you speak in terms of women and osteoporosis. I'm curious, can men get osteoporosis?
Yes, they can. And
Really?
again, that's another one of those things that people are not aware of. 1 in 2 women will probably get osteoporosis. And 1 in 4 men. So men do get it. And lots of times men get it because of medications or diseases.
Oh, I see. So are women more at risk then?
Women are more at risk, just naturally.
Naturally.
Part of it is because of the bone structure of women, but also because of hormones. And after menopause, after the body stops producing estrogen, the likeliness of the bones losing their density increases.
So is it safe to say that men get it primarily due to medications and things like that? They're not predisposed to?
They're not as predisposed to it as women. Low testosterone levels can cause it also. But usually men, it doesn't manifest itself until later, after age 70. But more men are likely to have a bone break because of osteoporosis than they are of getting prostate cancer.
Really? I would never have thought that.
But 1 in 4 men could have a bone break because of osteoporosis.
Wow, that is such great information. I'm curious, does family history come into play with osteoporosis?
It does. If your family has a likelihood of, a family member has had osteoporosis, you are more likely to also get it. And part of that is due to bone structure. Part of that is to diseases that the family may inherit. Also, it is race.
Really?
Caucasians, Latinos, and Asian Americans are more likely to have osteoporosis than African Americans.
Wow, that's so interesting. There's so many facets to this disease.
There really is.
I had no idea. I'm sure there are tests or screenings out there that can be done to determine your propensity to have osteoporosis. Let's talk about those options.
There are bone density tests.
And
the recommendation is that for women after menopause, if you have any of those risk factors. So the risk factors would be family history, your race, and age, I guess, is one of them. Yeah, that you need to have a bone density test after menopause. If you don't have any of those risk factors, again, after the age of 65. Men, if you have some of the risk factors after the age of 50, start talking to your doctor. Do I need a bone density scan? And get in there and see. They can. It's not really an X-ray, but it actually can scan your bones. Takes about 15 minutes. You do it totally clothed. It doesn't hurt, and it can scan your bones to see if you are experiencing bone loss.
And again, what age did you say women should have their first bone density scan?
After menopause.
After menopause.
If you have a risk factors.
Okay.
After 65, if you don't have any risk factors.
Okay. That's really good to know.
Now, there are some risk factors that you can do some things about.
Really?
You can't do much about your age, and you can't do much
Right,
about
can't
your
change
race.
that.
You can't change your gender, but you can change your health habits, some lifestyle kinds of things. If you're not prone to eating calcium-rich foods, could pick that one up. You can also, smoking can cause bone loss.
So that's a factor.
It is, and excessive alcohol can cause bone loss. And then also, and then obviously your diet.
How about exercise? Does that help?
It definitely helps.
Really?
But you need to think about weight-bearing exercises.
And explain what weight-bearing exercises.
What you need to do is you need to be moving your muscles, so that is also actually moving your bones and building your bones and strengthening your bones.
Well, in the short period of time that we have left, can you talk a little bit about treatment options?
At this point, there is no absolute cure for osteoporosis, but there are lots of medications out there, and they're developing new ones all the time. Some of them can be taken orally, some of them are intravenous, some of them are actually injections. And there's a variety of from once a day to once a year kinds of treatments.
So they really just need to consult their physician
They really
and talk about that.
Lots of new treatments out there, and they're working at it.
Great.
So if you've tried one, you may say, go back to your healthcare provider and say, let's look at some of these other options. Some of them are actually, they're finding rebuilding bone, which is good to know.
Good to know.
Yeah.
Well, folks out there, the viewers out there, who would like more information, they can contact the Brunswick Extension Office. Is that correct?
Yes, the Brunswick
And
County Cooperative Extension is in Bolivia at the County Government Complex.
And we'll supply our viewers with that
great.
phone number. Thanks so much for being here today. We appreciate it.
You're very welcome.
Our last guest is Amy Myers, Director of Marketing and Community Relations at Brunswick Community Hospital. Amy, it's so good to have you back on the show today. The last time you were here, we talked about the foundation for the new hospital. And for those of our viewers who didn't get to meet you last time, tell us a little bit about what you do at the hospital.
Sure. Well, thanks for having me back again. I'm excited to be here. My official title at the hospital is Director of Marketing and Community Relations. So kind of various functions, with marketing probably being the main one. Also work with our volunteers and our service excellence program, our community relations efforts, and then most recently with the foundation, which is really the not-for-profit fundraising arm of the hospital.
Great. Well, I know you're really getting excited about opening the new facility. Is it still on target?
Yep, and as you can see from where we're located, it's
right.
going really well, and we can't wait to get in. The end of the summer, we'll be moving into the new hospital and seeing patients here in the new building.
Well, as our viewers can see, this lobby is beautiful.
Yeah, well, thank you. Thank you.
I know you have several events planned for the opening of the new hospital. I believe the first event, though, is the foundation event. Let's talk about that a little bit.
That's correct. It's going to be a really special event because it's the first event of the Brunswick Novant Medical Center Foundation, as well as the premier event for the new hospital. So it's really two great things coming together at the same time. And that's going to be on the evening of Thursday, July 14th. It will be a fundraising event, so we're looking for sponsors right now. So we've got some sponsors in the community who are going to help put on that event, and then we're also selling tickets out in the community, which are $100 each. So we're really excited about everything we're going to be able to do that night, and then with the proceeds from the event. So, and that night it's going to be sort of a movie premiere style red carpet event.
Well, that sounds exciting.
Yeah, so we're going to kind of roll out the red carpet and bring people in, and we'll have entertainment, music, food, great food, and tours of the new facility. So people have the opportunity to see the whole facility, and also just to meet neighbors and friends who are also here at the event.
Yeah. Are you selling tickets to the event, and are sponsorships available for this event?
Yeah, that's correct. That's correct. We've still got sponsorships available as well as tickets for purchase. We did send out invitations, and we're also just taking phone calls for people who are interested. So if there are folks who are interested in sponsoring the event, they can call either myself at 755-1244 or Sally Henry, who works with me, at 755-1453. So we'd be glad to talk to folks about sponsorships.
Good, good. You must be planning several other events. Let's talk about those for a little bit.
We are. That'll be the premier event, that first night on the 14th. Then on Saturday, July 16th, the Saturday following that event, we'll have community tours and a ribbon cutting. So that event, we do expect a lot of people to be here. So we'll have a ribbon cutting at 1, and at the same time we'll begin tours of the facility. So we'll allow the community to come in and see the patient room, see the emergency room, get familiar with the new hospital, so that, you know, if indeed in future weeks or months or years they need to come here for a service, they're already familiar and know what the facility looks like. So I think that'll be a really fun, family-oriented day where we can just get everybody from the community in to have a chance to get that first glimpse of the new hospital.
And that's the official ribbon cutting ceremony?
It will be.
And what day is that again?
It's Saturday, July 16th. The ribbon cutting will be at 1, and the community tours from 1 to 4. And we won't be open at that point. It's a sneak peek or a preview event of the new hospital, because obviously we can't have tours once we have patients in the facility. So we won't actually open for patients until a couple weeks after those events. But we will go ahead and do the ribbon cutting and have the community come through for tours.
Well, this facility is beautiful, and I love it, and I'm really excited. What do you think the community will be most excited about within this new facility?
Yeah, well, we're incredibly excited as well, and I think, for me at least, what I think the community will probably be most excited about is that we're going to have all private rooms in the facility.
Oh, that's great.
It really is, and for those who visited the current hospital, people know that we have semi-private rooms mostly. So most of our rooms you're going to share with someone else. And
how about bathrooms?
All the rooms here have a private bathroom as well, so you have your own room, your own bathroom, your own TV. So,
well, that's important. Own TV.
It is. Yeah, we always joke that, you know, when people are well and at home with a loved one, they don't even want to share the TV, much less when you're sick and someone you don't know. So it's going to be great to have those all private rooms in the new facility. There's also great colors, and as you can see even from right here.
Very soothing colors, beautiful, beautiful furniture.
Exactly. The white walls and gray of kind of the old hospital design are just gone. It's blues and greens and oranges and really cheerful and calming colors that we think you know, will really be better for people when they don't feel well. You need that soothing environment.
So let's get back to the tours a little bit. tell me how that's going to work and what areas we're going to be looking at.
Sure. Well, we talked about the private rooms. That's one area that we know people are going to want to see what the patient rooms look like.
So everybody will get to see or have an opportunity to see a new room. And
Yep. And they'll see the features of the new room. They'll see that. They'll also they'll see almost every area in the hospital, from the cafeteria to the emergency department. To the surgical services area, where you'd come in and if you were going to have a surgery, where you'd come in and get registered and all of that. You'll see the radiology area, some of the new radiology equipment, because we have some.
So we got all.
We do.
So you have all new equipment?
We do have all new equipment in the radiology area, including a new MRI and a new CT scanner, which is something people ask about a lot. And the MRI is actually known as an open bore MRI.
What does that mean, Amy?
It looks a lot like a CT scanner, so it's not a completely open MRI, but a lot of people are afraid of the old closed MRI. Yeah, exactly. It's not like that. It's not like that at all. It looks much more like a CT scanner. So basically it's a long panel and you almost like a donut. You go through
so you just
one
go through the
small
middle
area.
like you do?
Yeah.
Oh, well, that'll be much more comfortable for
will.
folks like me.
It will, exactly. So it's important, I think, on those tours that people are able to see that MRI, to peek in and get a look at that, to see the CT scanner, to see some of the x-ray equipment. And also I think people are going to be really excited about the emergency department.
I was going to ask you about that. Is it much larger than the old one?
It is a lot larger. We have about 12 beds at the current hospital in the emergency room. We'll have 22 in this new one, so it's almost double the size. Wow. And the other big difference is that we're going from, in the current emergency department, where most of the rooms are separated by curtains, these are separated by walls and breakaway doors, so much easier to maintain privacy in that kind of environment. The nurses' station is also right in the center of the emergency room, so that the nurses and doctors always have visual sight of all of the rooms around the nurses' station.
Oh, so from a safety perspective, it's the best.
Yeah, we've always kind of made the best and worked very hard to protect safety in the current facility and to maintain privacy. But this new facility is just going to make that easier in every area. So,
and the privacy thing is very important. When you just have the curtains, you can hear everything that goes on.
Yeah.
But with these new partitions, walls, it'll make it much better.
Exactly. And it really is. They're rooms, so it's walls, and there's just a glass door at the front, so that there is that visibility. But it's going to be so much different when people walk in. I think they'll just know immediately. There's also 2 trauma rooms. In our current facility, we have just 1. In this one, we'll have 2, which is great, because if you think about a trauma situation, most often it's a car accident. That's just the most typical trauma situation we probably see, and usually that involves more than one person. And so it will help to have those 2 trauma rooms right next to each other, so the physician and physician assistant and nurses can actually work between rooms if they need to, and they're just really great state-of-the-art trauma rooms, so that's going to be a great addition as well, and that'll be available for people to see on the tours as well, so they'll even get to get a glimpse of those rooms too.
Amy, this has just been great. I've enjoyed having you here. Thank you so much for coming today. But I'm sure that we have viewers out there who may like more information about the foundation or about the events that are coming up. Can you tell them how they can get in touch with you?
Sure. And thank you for the opportunity to be on the show. It's been great. They can call me directly at 755-1244, or they can call Sally Henry, who works with me, at 755-1453. So either of us would be more than willing to talk about sponsorships or about the events coming up or anything else related to the hospital or the foundation.
Great. Thanks again. It's been a pleasure having you.
Well, thank you. Thank you.
Thank you for tuning in to this very special edition of Health Watch on ATMC-TV. I hope you're as excited as we are about the new Brunswick Novant Medical Center. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmc-tv@atmc.coop. I would also like to encourage you to participate in Novant's monthly Focus on Health seminars. These seminars are held on the 3rd Thursday of each month in the Brunswick Electric Community Room. During these seminars, local medical professionals discuss health topics of interest and answer your specific questions. Please check the local newspapers for additional information or visit brunswickcommunityhospital.org. Thank you again for joining us today. Be sure to join us next time for Health Watch on ATMC-TV.